Emergency services basically is there to try to provide medical care for people in either their life-threatening or emergent situation. Different situations that would warrant a call to 911. Number one would be chest pain or pressure that lasts more than a couple of minutes or comes on with some type of exertion. Any type of shortness of breath out of the ordinary. If you're running and you're short of breath and you sit down and you're not short of breath after that, that's not an emergent condition. But if you're persistently short of breath and can't catch your breath, then that would be a reason to call 911. Any type of choking episode, we do recommend a 911 call. Altered mental status or some sort of an acute confusion episode. Any type of burns beyond like a sunburn. But if you have blistering, if you have burns to the face, if you have burns to large parts of the body, then a 911 call needs to be initiated. Anytime somebody is vomiting or coughing up blood, large amounts of that, they should call 911. If someone can't speak well, they have a facial droop, one side of their face is drooping, they have numbness or tingling to one side of their body, they have balance problems. Those are indications maybe for a stroke, and they would be a reason to call 911. For the regular layperson, if they feel that their medical condition can't wait to schedule an appointment with their doctor, then it's an emergent condition. Things like a urinary tract infection, chemical type exposures, minor sprains and strains or sports-related injuries, falls, minor car accidents that you're able to drive away from, but maybe you've got some neck pain, minor allergic reactions. The other things would be things like domestic violence, sexual assault type injuries, any type of vomiting and diarrhea where you're concerned about dehydration, any types of fever with cough if you have a concern for pneumonia. And maybe they're not life-threatening, but we're there to take care of you. Kids as young as 3 years old can actually be educated, but also they need to understand that it's okay to call 911 if they don't have an adult that can respond, or if the adult is not able to talk, then that is an indication that they would want to do it. And we actually recommend putting the phone number and the street address of the home near the phone. If you do call the 911 operator, you need to make sure that you stay very calm, and you need to make sure that you stay on the phone with the operator. You need to make sure that you have the name and location of where you are, or at least crossroads or streets. Oftentimes, if it's a cell phone, they are able to try to access that information through cell towers, but if you have that information, it provides them a little bit more direction.